All right, so just going to do a quick recording with Dr. Ray Lynch, a client of mine. Mike has some numbness in his arm. He noticed it come over him a couple weeks ago subtly, and so I just referred him to Ray to see his thoughts on it, see what's going on. Talked to Ray a little bit briefly about the issue, and just highlighted to him that Mike was on my program, and that there's the only out of the ordinary thing on the program was that he missed one of his bench numbers, so that was a potential area for him to look into. But anyways, I'm going to get Ray on the phone here in just a second, and I just want you guys to see real time our conversation between strength and conditioning and physical therapy, and kind of the collaboration we're going to have with seeing what's going on with Mike, what Ray did, what he's going to do, and what I need to do on my end in terms of the programmer for Mike's current training routine. So we're going to go ahead and get Ray on the phone, and then we'll talk about what's going on.
Hey, what's going on, man?
Hey, what's up, Ray?
Oh, not much. Just sitting here waiting on my wife to get here with Grayson. She's got studies, so
cool.
I'm gonna actually watch him tonight. So
awesome.
Get a good lift in, man.
Yeah, it was all right. Just some quick squats. Well, not quick squats, heavy squats, and a quick bench recovery day. So.
Gotcha. I gotta do something tonight, man. She gets home at 9, so I'm gonna try and get in about 9:30 or so and try and get it done.
There you go. I didn't know physical therapists lifted weights.
Yeah. Get out of here.
All right. So I don't want to keep you too long. What's going on with Mike? I know the only information I gave you was the program he's on, and he missed that bench number, and I don't know. Kind of take it away from there. Let me know what you guys talked about and what happened and what I need to do, and go for it.
Yeah, man. So what I did is, so we kind of came in with a primary complaint of basically paresthesias, or kind of this numbness, tingling, feeling like your fingers were asleep, and actually all the digits of his right hand on the palmar aspect, so just on that side, not the back. So it's kind of like, man, I don't know if this is a neck issue or a neck issue leading to a nerve issue, or maybe even just, like something carpal tunnel related. So those kind of things were in my mind right off the bat. And as we moved through the exam, so I did some posture, noted a couple things actually going on in his right shoulder, but I was like, I don't know, it may or may not be related, but it wasn't really high on my list. So, man, I went in, I looked at his neck, kind of first and foremost, just to see, thinking that's probably where most of the symptoms are coming from, because multiple nerve root levels were showing up in the hand, and there wasn't just any one peripheral nerve. And so I did some tests, and I was like, man, nothing's coming back. I can't influence it by moving the neck. I can't do anything that changes it. The only thing that changed it a little bit was when he tucked his chin and then brought his head down. He had a little bit of increase in symptoms in his right hand. But anything else I did at the neck, added any compression or distraction or rotation, anything, nothing changed it. So I was like, well, all right. As much as I want it to be the neck, I don't think it is. So then I said, well, let's go ahead and look at the next thing. Let's look at just nerve mobility and see if it's just neurogenic. And no, I'm okay. And then I was like, well, I'll just test the nerves and see if there's anything restricting there. Well, in his subjective history, he tells me it's not bothering him in any lifts in particular. Like, it's not increasing or decreasing. I said, well, how about front squats? Thinking, well, that puts ulnar nerve on some tension.
Sure.
He said, no, feels fine. I said, well, what about this other lift? No, feels fine. Okay. And so I looked at his nerve mobility, looked the same, side to side, no increase in symptoms when trying to roll in and roll out for things such as carpal tunnel syndrome. Looking even at the elbow, I was like, man, I could not reproduce or change his pain at all. So I just kind of, man, at the very end, I was like, well, the only thing left on my list based on what I saw from the very beginning is he's got a little bit of atrophy in his right infraspinatus. I don't know why, but I know that the muscle referral pattern actually is down into thumb, index finger, and middle finger. I said, it's not all of his pain, but let me see if it influences it. As soon as I found a trigger point, man, pressed on it, he's like, and I didn't give him any information. I wasn't like, this should increase or anything. Didn't try and add any kind of placebo.
Right.
No information. Right. I just said, hey, I just want to take a look at your thoracic spine, your neck, and your shoulder while he's on his stomach. And just pressed there, and all of a sudden he actually had a reproductive symptom. So,
wow.
Yeah, which is crazy because it was really low on my leaderboard based on subjective history, way low. But there's a couple of things going on that I'm seeing from a postural standpoint. So he's a little bit more chest dominant on that right side. So his arm at rest is a little bit more internally rotated. His scapula is a little bit more anteriorly tipped. So potentially either like a pec minor issue, or it could be any number of things. So I don't know why there was a trigger point in his infraspinatus. I don't know if it was overuse, or if it was compensating for one thing, or if it was just in an abnormal position because of where his shoulder blade was set. I really don't know why it was there, and that's actually going to take me a couple more sessions to investigate, if I'm being honest, and continue to roll out the neck. He doesn't have there's no reason to limit him in any of his exercises, except for maybe right now just limit a little bit of overhead activity until I can just figure some things out. Other than that, he's good to go.
Gotcha. So no needing to adjust any major movements, no needing to adjust loading parameters or anything like that?
No, to be honest with you, I don't think so. I think maybe just until give it another week or so, and then he can probably start to ramp back up on some overhead lifts. It's not a problem, but he's got a couple things that make me concerned that if he doesn't address it, so from a scapular positioning and just how it's moving, and a little bit of the atrophy on that right shoulder, that he could set himself up for a right shoulder injury in the future, but there's no guarantee to that. So I'm more or less just trying to make sure that that's all it is. So I only did one thing. I dry needled his shoulder, infraspinatus, reproduced all his symptoms, and calmed it down, and then I'm basically just going to see, does that last, or does it just come back? But other than that, man, I wouldn't adjust any loading parameters or anything like that. I think he's good to go. He's good to continue in his squats, good to continue in everything. Just hold off on overhead so that we're not adding any more to the soup.
Gotcha.
Right now.
Gotcha. Okay, so potentially with more investigation on your end, there might be, with more information that you collect, there might be some future adjustments in terms of exercise selection, or maybe some potential upper back work, something focused.
Yeah, maybe. Yeah, I would say even not. I think exercise selection's fine. So I haven't got the chance to go through and look at his entire sheet because he had it on his phone. So we can chat about that a little bit later if we need to. But from a addition, we may kind of discuss that, because we may want to target that right rotator cuff specifically, just at home. He doesn't have to do anything crazy. He can still, and needs to still load it, but I think he's so smart that he's compensating for that weakness on that right rotator cuff. So we may isolate that, but we're not going to take him off of any of the other lifts that he's doing. That just doesn't make any sense. We'll just give him some homework.
Okay, great. That sounds good. All right, man, I know you got your family with you. I just want to give a quick call and just kind of get the conversation and see where you're at with it, and if there's anything I needed to do right now. But I'm sure we'll discuss it more as you dive into it a little bit further.
Yeah, absolutely, bud. Well, shoot, I'm going to take my son on so my wife can study. But, yeah, that's pretty much it, man. I'm suspecting it's potentially trigger point. There's a couple other things it could be, but, until we get more information and see how it responds to different interventions, I don't think it's anything serious right now.
Okay.
So
Okay. And one last quick question, just for information's sake, and by all means, be honest. I'm not trying to plug anything here, but from your diagnosis or your thought process, did it help knowing that you had exactly what he was doing for the last month in front of you, like having an organized, structured routine? Did that kind of help translate and kind of dial in your thought process or potential future?
Well, I think the reality is, when it comes to mechanism of injury, right? So if you were to say, I'm not really sure what happened, well, I can look at his list, and that's what made it helpful, is I could look at his list, say, okay, what's changed, what hasn't changed, has this load changed? So it's as a physical therapist, and someone comes in and they lift, and you say, well, hey, what have you been doing? Well, I don't know, I just kind of walk in the gym, or I just kind of do whatever the workout of the day is. That's a whole lot harder to figure out than, hey, yeah, this is my workout, this is exactly what I do. So
Gotcha.
Not only does it help from a diagnosis standpoint, or at least giving me some ideas of what to potentially look at, but it also tells me what we may need to adjust. So he's already got a plan, so we can adjust it easier too, so that we can get right back to it. So yeah, 100%.
Perfect. All right, man. Appreciate it. Like I said, just wanted to ask that real quick, and I'll let you get off the phone, and we'll discuss it more as you keep diving into it.
Yeah, absolutely, man. We'll talk to you later.
All right. Thanks, man.
All right, man.
Bye. So yeah, that's pretty much how the conversation is going to go typically with any sort of collaboration there, just trying to figure out what's been going on. I really wanted to emphasize that point of understanding a structured program isn't just for progress or things like that, but for issues like this. This was a real-time issue. There's a potential injury, and having a plan, having that program helps out those in this case the medical field. It helped Dr. Ray out with figuring out what to do, what was going on. You know, it really helped with the information, right? When you're randomized in your exercise, you're going to reap random benefits and low amounts of benefits, but also you're making it really hard for people to help you when it comes to potential injuries, right? If you have so many stokes in the fire, you don't know what's worked, but you also don't know what hurt you, so that can make Ray's job pretty difficult. So I just wanted to make that point clear from the programming standpoint. And then like Ray said, he's got to do a couple more sessions with Mike to figure out what we need to do in terms of exercise selection. And again, that's when we're going to really see the program layout come into play again, with trying to implement exercises, things that we can do to help facilitate this recovery while Mike still gets to train productively. So it's kind of hitting two birds with one stone. Again, the beauty of having an organized program, he can rehab at the same time that he's just continuing on with his gains. So I just wanted to make this quick video and show you guys kind of how it works in real time. And yeah, that's it.